Okay, hi everyone. I'm Dr. Jasmeka McCord. I will be presenting to you all on human trafficking in the healthcare setting. So thank you all for the opportunity to be here, and I'm going to get started. Okay, so human trafficking in the healthcare setting, ways to identify, isolate, and intervene as it pertains to victims. I would like to give a special thanks to Drs. Harriel Deshomes, Malcolm Dix, and Evelyn Kassim, as well as Dr. Suzanne Harrison, for their participation and their contributions to this presentation. My objectives are as follows, and I'm going to move this so that you all can see me. Okay, my objectives are as follows: to define human trafficking and identify the scope of the problem, to recognize the common indicators and red flags for human trafficking, to discuss the approach to a patient who may be a victim of human trafficking, ways to identify resources for patients impacted by human trafficking, and finally, ways to identify support organizations and ways to help victims. So we'll start with chapter 1, what is human trafficking? An overview. So human trafficking, in short, is a form of modern day slavery. It involves the exploitation of persons for forced labor or commercial sex. It often involves moving victims from across international borders. However, as you'll soon see, this is not a requirement for the definition. Victims are frequently held by the invisible chains of psychological coercion, and there is often a criminal offense against a person. But the baseline of human trafficking is that it's a form of exploitation and modern day slavery. So slavery still exists. Here are the definitions that I want us to be able to understand and identify with. So human trafficking is an umbrella, and underneath that umbrella exists sex trafficking as well as labor trafficking. Sex trafficking in specific is the exploitation of a person for a commercial sex act that is often induced by force, fraud, or coercion. That's something that I want us to be able to recognize and understand. So in this definition, a person is coerced or forcibly put into sex trafficking. And you don't need to prove that force, fraud, or coercion for a minor victim. It's just something that is understood. If they're under the age of 18, then that definition already applies. Now, on the other hand, labor trafficking, which is a little bit less common, something that people are not less common in the sense that it's less prevalent, but less common in the sense that people do not recognize it as much. It is the exploitation of a person for labor or services through the use of force, fraud, or coercion. So either way, in whether it's sex trafficking or labor trafficking, force, fraud, or coercion is involved. Now, the next thing we want to talk about is the difference between human trafficking versus human smuggling and some other things, because this term can be confused with other things. Now, we have different categories to help you kind of discriminate between smuggling and human trafficking. In terms of a border, you can have international boarding crossing. That is a requirement for smuggling. However, it can happen in human trafficking, but is not a requirement. The crime would be crossing the border. So it's a crime against whatever laws of that country or state that the person who is being smuggled is committing. Versus in human trafficking, the crime is against the person. It's against the person who is taken under coercion. Human smuggling is voluntary versus human trafficking is involuntary, and the intent is to transport a person in smuggling. However, in human trafficking, it's all about exploitation. Someone is trying to get something from that person. Human smuggling often becomes human trafficking, but the two things are different. I have frequently asked questions embedded in the presentation. So the first one we're going to encounter is what's the difference between human trafficking and prostitution? This is something that often comes up. Now, there's a lot of words on this slide. The one thing that I want you all to understand is that human trafficking, again, is under force, fraud, or coercion. It's not voluntary. However, prostitution is. The second thing that I want us to understand is that whether it's prostitution or trafficking, you want to treat that person as a human being, right? What's most important for us is to listen to these stories and these reports without judgment or assumptions, okay? There is a difference between the two, but the most important thing is for us to treat that person in front of us. I will be giving a lot of clinician references because I'm coming from a clinician perspective, and we'll get to that later on in the presentation. So the second chapter is to ask about, why is human trafficking this important? Let's discuss that. because it's so common, right? This is a global issue. There's over 40 million people involved in a form of modern day slavery worldwide. These statistics are from 2018 and 2017. There have been updated statistics as of 2021, but we're still trying to figure out the post-pandemic numbers and how they relate. And so I've just included the most pre-pandemic statistics in this presentation. There are 1 in 4 victims of slavery that are children, and then women and girls are disproportionately affected by forced labor. And we have the statistics there for if they're involved in the commercial sex or labor statistics. And then why? Because it's a profitable industry. $150 billion is estimated. This is a map that illustrates human trafficking in the United States of America. The darker, redder, orange-red areas are more prevalent. If there's no area, like colored area at all, it's not existent or reported in that area. But again, remember, this is human trafficking, so it's not something that is likely. Statistics are less representative of what is actually existing out there. So as you can see, the red or orange areas are often along the borders of the states. You can see along the California coast, so Texas, Georgia, Louisiana, Alabama, South Florida states. You can see that it's prevalent in those areas as well, making this demonstration or this presentation very important for our South United States attendees. Here are the top 10 locations that kind of just puts in words what was illustrated on the previous graph. Now, what are common facilities and businesses used for human trafficking? Oftentimes we'll see that there are already businesses that may have a legitimate appearance on the outside, but when you dig deeper, then there's some type of illicit behavior or activities going on. So that may be at massage parlors or spas, construction sites, that's the labor portion of it, underground bars, brothels, strip clubs, malls, any of these areas that you may think are just normal may be a source for human trafficking. Chapter 3 involves who is involved in human trafficking. This is so important for us to understand because if you pay attention to this slide, you'll see that the range of traffickers is so vast. You can have someone who is just a family member, a mom, a dad, an uncle, a cousin that run mom and pop operations. And then that goes as vast as someone who is a diplomat or organized criminal syndicates. You can have regular pimps, business professionals, neighbors, friends, relatives. There really is no exclusion as it pertains to who can be a trafficking victim or a trafficker, excuse me. And one person or group of people I want to really highlight is that of healthcare providers, okay? Typically, when you have illicit behavior in some type of system or that is like on a mass level, you have to have someone who is supposed to be defending or treating victims that is unfortunately on the wrong side of the crime within the system itself. So we have to be cognizant and vigilant about anyone who could be a human trafficker. Another FAQ are what are the social events that are common hotspots for human trafficking? Now, of course, any event that attracts a lot of attendees, a lot of money in the area, a lot of tourism, a lot of just transactions is going to be a hotspot of human trafficking. The Super Bowl is one of the most, I think, the most televised event in the United States. Olympics or World Cups, concerts such as Coachella, Mardi Gras, Pride Parade, any type of event that recruits a lot of people to an area is going to be a hot spot or so a common social area for human trafficking. So now that we've discussed, what trafficking is, who are the traffickers, now we want to talk about who is at risk, and it's going to be any vulnerable person. Okay, this can be a woman, this can be a man, this can be a child, this can be an adult. Any vulnerable person is at risk for human trafficking. And remember, we're not just talking about sex trafficking, we're talking about labor trafficking as well. All of those are under the umbrella of human trafficking. This can include runaways or homeless youth, those who are disabled, have mental illnesses, LGBTQIA plus population, those in foster care, those who are marginalized, oppressed, impoverished groups or individuals, immigrants who may be documented or undocumented, who may not be familiar with the area that they're coming into, those with unstable housing who may be out on the streets for periods of time, those who recently migrated or relocated to another area, again, with immigration, may not be familiar, those who are victims of substance abuse or violence or abuse. Anyone who may be considered vulnerable is at risk for human trafficking. Now, how are they recruited? Now, when you think about the people who are at risk, those are aligned with the ways in which they recruit these victims. We already know that the underlying theme is via force, fraud, or coercion. They may be captured under the false premises of jobs. I was just looking at this 2021 statistics, and that is a big area of concern, whether that's via internet advertising, whether that's via any type of advertising where they're recruiting for a job. That may be a way in which they capture their victims. You may have a relationship of, again, we spoke about how these may be friends or neighbors or relatives. You may have a relationship with that person. This person may be a boyfriend, a girlfriend, a significant other who turns out to be a pimp. So they recruit them under false premises, under fraud, with coercive activities, and then they capitalize off of that vulnerability. So the victim is now captured. Well, why do they stay? This is a very important concept to understand, because if you don't, you can come off as judgmental, thinking that this is a voluntary thing, right? When you understand that this is involuntary and that people are captured, against their will, then it's easy to understand why they stay. They're subject to violence. Their traffickers may be abusing them. That violence may be for themselves, the victim themselves, or of a family member. They tell them, if you try to leave, then I'm going to hurt your mother or your sister or your brother, and they stay under those conditions. They may be isolated away from others so that they are unable to escape. They may have some type of debt bondage, a threat of exposure, traumatic bonding. One thing they may say is, if you go and run away, or if you get away, then I'm going to put all your business out there. Maybe they'll put pictures that they've captured during the acts that they may expose to the world. This is exploitation. So it is not an easy way to get out of this. Okay. The victims are especially difficult to identify because of these coercive ways in which they keep them. Now, are there medical impacts of human trafficking? Absolutely. The things that we have listed here are physical trauma, chronic diseases, STDs, of course, unplanned pregnancies, drug addictions, suicide, psychological trauma. There are myriad of ways that there can be clinical impact, clinical manifestations of human trafficking. And oftentimes we are treating unaware. As providers, we come into contact with multiple patients in a day, in a week. And oftentimes traffickers come into these settings without us knowing. We have a quote here from one victim who said, "During the time that I was on the street, I went to hospitals, urgent care clinics, women's health clinics, and private doctors. No one ever asked me anything anytime I ever went to a clinic." And that is a striking reality. That's why we have to be very vigilant and pay attention to the signs and the clues, or have screening mechanisms in place that can help us identify these victims. And here listed, we have other statistics on, who was in a healthcare setting, who came into contact with the healthcare provider, and, whether it was an urgent care, a private hospice, an emergency room, and were not identified. And we're working on improving those statistics. Now let's transition into what are the factors that help our barriers to help us, to prevent us, from identifying these victims. So just kind of a continuation of what we just mentioned. Here are the barriers from the different levels of barriers. So let's start with the barrier for the clinician. I'm the clinician who walks into the room. Typically, this interaction is very brief. As we know, the burden on our healthcare providers has become very taxing in trying to see the most patients in the least amount of time. This may be a burden for a practice themselves, or for a hospital organization, or as a whole. There are often incentives and bonuses for people who can see as many patients in a little bit of amount of time. And you have that going against you when you're trying to be attentive as a clinician. There's a lack of knowledge, but now we're really working on that because most healthcare systems have some type of human trafficking workshop or certification that you have to have. And then a lack of expertise. Maybe you can identify them, but you don't know what to do with them. So from a clinician standpoint, there are barriers that exist. Now, from a patient standpoint, obviously the patient coming in knows that they're in a situation that is hard to get out of, but these at-risk individuals are from marginalized groups. They're severely traumatized. They have multiple issues, complex needs. And again, we talked about the threats that they have to endure that may prevent them from disclosing their status as a victim. And then American culture is hypersexualized. You may come in and see, and we're going to talk about the specific signs that you look for, but maybe as a provider, you may not think what you see in front of you is questionable because it has been so normalized in society. Now, we want to talk about some human trafficking indicators for perpetrators and for victims. What you might see if a trafficker comes into a healthcare setting. Now, a victim may be accompanied by a controlling person. They may not want them to do certain things or say certain things. They may not allow the patient to be seen alone. This is especially important in pediatrics. If we have teenagers, often we ask them questions that we require them to be alone. If we want to ask them questions about sexual history, about their mental health, we ask parents to leave the room. If parents are a little suspicious, don't want to leave the room, make it a big deal, that's something that you may have to think about in the back of your hand. Like, what is the relationship in this situation here? What do they not want them to disclose to the clinician who is supposed to be helping them? They may not want them to answer a certain question. They may interrupt the patient when they're, telling their portion of the story or talking about what may be wrong, or correct a person when they're attempting to answer. The patient or the victim of trafficking, you may see their eyes looking towards the perpetrator whenever the clinician is asking them a question so that they give the appropriate answer. If they're not, if the perpetrator is frequently interrupted by calls or texts, then these are things that you might want to consider that this may be a perpetrator in the room. On the other hand, you may have indicators for the victim. The person who you're treating or suspicious for may be anxious or fearful. They may be depressed. They may have substance abuse. They may not know what time it is because oftentimes they're in such terrible conditions. They may be in a basement all day, not in Florida, but they may be in a room all day where they don't know when the sun comes up or down. They have no idea what time it is. They have inconsistent or scripted histories where they keep saying the same thing. And when you try to probe for more information, they're not giving you more details. Or it's inconsistent. One time they said this, the next time somebody else asked, they said that, and then it continues to change. They don't know where they are. They don't know what their address is. When you ask them questions about their number of sexual partners, they can't give you a number. It's an unusually high number. And then there's a discrepancy between what they're saying and what you observe. Oh, I hit my arm on the wall, but they have a significant fracture. These are things that are not consistent with their story and things that may need you to take a closer look as a clinician or a provider saying, I should be a little bit more suspicious of this behavior. Now, labor trafficking indicators are a little bit different, right? Remember, again, under the guise of human trafficking, under that umbrella, we have human sex trafficking and labor trafficking. Labor trafficking indicators can be that they're not provided with an adequate protective equipment or for hazardous work. If the employer doesn't give them eyewear or goggles or gloves or different coats, different things that may be crucial for the job that they do. If they're required to live in housing provided by the employer and they do not have the option of living somewhere else. If they are recruited for a different work than what they're currently performing, if they don't have enough breaks, if they have limited access to food and water, if they're abused at work, these are things that you want to think about. Like maybe this may be a labor trafficking situation. Now, indicators specifically for sex trafficking in and of itself is that you may look for visible body signs that may be suspicious or different type of situations that don't align with the current season or different things. So let's go through these. So branding, if they have tattoos, if they have different tags. If you see here on an x-ray in the bottom left corner that there is like a little bit of a chip there in the hand that traffickers may put in their victims as a way to keep up with them, to know where they are. Again, mention if they have high numbers of sexual partners. If you're dressed in short shorts and a midriff top in the middle of winter in Georgia where it's 25 degrees outside, it's an indication that this may be some type of inappropriate situation going on here. If they're appearing much younger than their stated age. You may have a 14-year-old who's being trafficking that they're told to say they're 25 because they don't want to attract too much attention. If you have victims who are severely malnourished, who have been victims of trauma, a lot of different bruises all over the body, these may be indicators of victims of sexual trafficking. Now, the purpose of this slide is for us to understand how much of an invisible trauma in healthcare that this is. This is an worst case scenario of a victim of trafficking who may have 30 buyers in a day, right? There's 24 hours in a day. These people may have 10-minute slots or 15-minute slots where they're having multiple buyers coming in and forced to perform different sexual acts. That's happening every single day, no days off, right? 7 days a week. When you put those two together and you multiply the number of buyers that they may have and the number of days in a week that this happened, that can be 210 rapes or sexual acts that are done per week, okay? That may go unrecognized, all right? This is a major issue that we need to be giving a lot of attention to and trying to intervene as best as possible and as safely as possible. From a victim's perspective, that may be another barrier to identifying a victim, is that maybe they don't identify as a victim. They have been coerced to the point where it's something that they can't even, relate with anymore. They may not even feel comfortable disclosing that information because of fear, because of shame, distrust, because of a language barrier, right? If we think about people coming from different countries that are abducted and brought here under those means, then maybe they may not know how to communicate that with you, or maybe they don't want to be rescued. There's traumatic bonding that we have to consider when the victim becomes so bonded or so reliant upon their perpetrator that they don't want to be taken away from that person under this traumatic bonding scenario. So there are a lot of different things that we have to consider and know that this is not a straightforward thing. It's not easy by any means. There are a lot of barriers that you got to overcome to successfully identify and intervene with a trafficking victim. So let's say you have recognized all of these different signs and you said, okay, I got these red flags in my mind. I'm thinking this may be a perpetrator. I'm thinking this may be a victim. What do I say? Understand that you should never, ever question in the sight of the perpetrator. You have to separate the perpetrator and the victim. If you're able to do this, and now the patient is able to disclose that information to you, you want to validate that disclosure. Tell them this is not their fault, because it isn't. Tell them no one deserves this, because they don't. Tell them that there is help available, because there is. Let them know that you appreciate that they're disclosing this very personal information to you, and you want to be able to help them. Make a connection to them. They've been separated from their families and their friends. Is there someone that they need to call or can call? Do they want to talk to a victim advocate? Do they want to share more information, get counseling and help? Make sure that the person doesn't use their own phone when they're trying to reach out to other people, because oftentimes the trafficker controls that, and then this may be dangerous for them. Now, again, under the general approach, you always want to interview and examine the patient alone. If they don't speak the language, use a trusted and reliable interpreter. This is also an issue when it comes to healthcare, because oftentimes we do not have enough time, especially in an urgent or emergency care situation. But it is important to not use your version of jumbled Creole or jumbled Spanish or whatever language to be able to try to communicate. You need a trusted and reliable interpreter so that you do not miss anything, and so that you know the very important things that are most helpful to treating that patient appropriately. Consider checking the missing persons database if you're for these victims once they're identified, because oftentimes their loved ones have put out communications for them, and you want to be able to reconnect them with their loved ones. Maintain confidentiality, reassure frequently, and be truthful. This information does not make it back to your perpetrator until we can have you safely separated from them. Proceed carefully and without pressure. Do not make them say or disclose anything that they do not feel comfortable disclosing. Let them feel in control of the interview and in the examination. And this is an important point. Realizing that throughout this time that they've been under the control of their trafficker, they have not had control. So it's important to give that control back to the victim and let them know that they are in charge now, and how we proceed is under their terms. Put their agenda first, and use trauma-sensitive care when you're treating these patients. Again, if you cannot separate, do not ask. Now, initial screening questions should be, are you comfortable? Is there someone there with you today? Do you have a place to stay? Do you feel safe? Again, these are things that you ask when you're trying to recognize, and when you're trying to identify if this person that I am suspicious of is a victim themselves. And now, once you've got those screening questions out of the way and you're not sure, and the patient may not be disclosing, you want to ask them, do you work and sleep in the same place? Right? These are questions you may not think about as being alarming, but when you get a yes to that answer, think about the conditions in which that may not be appropriate. Maybe if they're a caregiver, fine, but that should be something that is separate. And if it is not, maybe a red flag. Do you know what city you're in? The address, again, things that we've mentioned already in this presentation, thinking about things that are just alarming. Have you ever traded, bluntly asking, sex for anything, money, food, drugs, prescriptions, security, against your will? Do you owe a debt for employment? Does someone control your identification documents? Things that we may not always think about, but if we ask them, can be so telling and give us a lot of information. Now, the safety assessment, right? So we're talking about ways to identify, isolate, and intervene in a safe manner. The safety assessment is crucial, because if you identify a victim and then send that victim home to an environment that is unsafe, when they were trusting you to be able to keep them safe, it can put you at risk. So do they have a safe place to go? Is the trafficker in the waiting room? Do you have your identification? Asking these questions helps guide what your next appropriate best step is going to be. Have you been threatened with violence? Are your loved ones threatened? Are there weapons present? Is there a history of drug or alcohol abuse? This helps us to know what things we have to consider when we're trying to isolate the victim and then follow up with the next best steps. Another frequently asked question is, what if we do suspect someone is a victim of human trafficking? They're showing clear signs, but they deny it. Unfortunately, the decision to admit to being a victim is up to the victim themselves. And then sometimes they may admit to being a victim, but are not safe with getting out of that situation. You reassured them as much as possible. You validated them as much as possible. You've talked about the resources that are out there that we're going to mention as much as possible, but they still decide that they do not want to get out at this time. Unfortunately, there isn't anything that you can do in that situation. We are in no way to coerce victims, okay? Then you're no better than the trafficker themselves. We are to encourage them and to provide the support that they are ready for in that moment. But the best way that you can arm them to be able to get out of that situation is to give them as much information as possible, to let them know there is a way out, to let them know that there are resources available to them, and to let them know that we are going to go after that trafficker once they say they're disclosing that information and that it's okay. Now, what is your role as a provider in these situations? Your next steps are to, again, once we isolated them for their victim, now you intervene. Now is the time to make a call to the National Human Trafficking Resource Center. Now is the time to call 911 if the patient is in danger. Remember, you're not always coming into contact with them in the emergency room or the urgent care or in the office. Maybe they're calling you on the phone and you're working for the hotline, or maybe you get a call because someone saw a flyer and they decided to call you, you need to know to call 911 if that patient is in immediate danger, and follow whatever protocols may be at that institution that you're employed with to kind of help facilitate that situation in a safe way. Recognize that a patient may be more fearful when law enforcement is present. This is actually very common thing, and walk them and talk them through that situation and help calm their fears. If you've encountered a patient who's come into your physical setting and they're not willing to leave, then making a follow-up appointment before the patient leaves the examination room and goes back with the trafficker is of utmost importance, okay? And here we have listed not only the human trafficking hotline, but also the email and the website that you can reach out to be able to report or get information for the victim themselves. What are victims of human trafficking insured? Are victims of human trafficking insured safety if their perpetrators are caught and released? Well, we have temporary shelters, housing, restraining and protective orders that may be helpful, but it is important to know that there's no guaranteed safety, okay? If these human trafficking victims are rescued, then we are going to contact our local human trafficking agency to confirm their specific protocols. We want to capture the perpetrators immediately, as quickly as possible, because we don't want them to follow through on their threats to harm their family members, to harm their loved ones. But we cannot guarantee that they will not do so. That is extremely important. We want to make sure that we disclose this information to our patients, okay? But we are going to, as soon as they disclose that information and they can tell us where they are, we can make the appropriate calls to the authorities who are able to intervene on the report that they have been victims alone, okay? So the arrest or acquisition of the traffickers can be made very quickly, but we still cannot ensure safety if the perpetrators are caught and then released at a later time. Clinicians are mandatory reporters. You report to the Department of Children and Families, or whatever is the department for those specific states. I'm from Florida, so I have the Florida Department of Children and Families here, but mandatory reporting to the Department of Children and Families. The reports can be anonymous. Failure to report by a parent or a guardian is a felony, and failure to report elder is a second-degree misdemeanor. You can, again, right, we've emphasized women and children, but this does not, they are not the only victims in these situations. Again, consider men, consider our elderly, any vulnerable victim. Call the abuse hotline if you know or suspect a patient. Again, there's the number is simple, 800-96-UP-THE-USE, okay? And then tell them that you think this could be human trafficking, and then they will follow the appropriate steps. Documentation is of utmost importance as well. You want to include specific components in your document, a detailed description of the disclosure. If you're writing notes in your facility, detailed physical exam findings, include photos of the drawings, not on your phone, but specifically from your whatever EHR may have access to photos, and include those in that documentation. Include whatever your concerns are in the assessment portion of that documentation, and document whatever follow-up plan that you engaged in order to keep this patient safe. And then, of course, this validates the patient's concern. This helps our court system, our law enforcement be able to intervene. And again, this provides resources for job training, for immigration relief, for welfare support for the victim. So it is really important. And lastly, we want to talk about the resources that are available for victims. We kind of touched on this already, but immediately, once that victim is identified, we can provide assistance in the form of housing, in the form of clothing, in the form of food. There are numerous shelters throughout different states, cities and states that may be able to accommodate these victims. They can provide language interpretation services, medical services, so that they can attend to whatever injuries or diseases that they may have contracted during their exposure to these different labor and sex conditions. Safety and security, transportation, income assistance. Once we identify victims, it truly is our job to be able to help them in the immediate and long term. Once we transition to long-term assistance, you can provide legal assistance to these victims, especially if they were taken across the border against their will. We can help with the immigration status. Trauma-informed counseling and care. Not only is it important to treat the physical ailments that these patients may be suffering from, but also their mental ailments as well. If you could just think about how mentally taxing it must have been to be under a situation where you were forced or coerced to do things against your will, that must have a major impact on your mental well-being. And so we have resources that are able to perform trauma-informed counseling and care, substance abuse treatment if they, had to drink a lot or smoke a lot or have drugs, whether it was their own will because they needed to handle the situations that they were going through, or if it was because their perpetrators forced them to do so. We can help provide treatment options for them and help them know life skills for recovery and career development for the future so that we can help them to integrate back into society. Listen to your patient. A survivor is the expert in their own needs. And that is the point that I want to drive home for you all. You can make a difference, okay? Post flyers in your different facilities. Recognize the victim's signs and symptoms so that you may be able to intervene in the best way possible. PSAs in waiting rooms and bathrooms. I'm hopeful that you all have seen these things already. And if you have not, can help implement these things in your respective facilities. Protocols for how to intervene, because intervening in an unsafe way is more dangerous than not intervening at all. Okay. Offer training for healthcare professionals and staff, and employ a team-based approach with case management and victim advocates. Okay. It is never the sole job of the clinician to interfere and get all the resources that are appropriate. Involve social work, involve case management, involve victim advocates, involve psychologists and psychiatrists, and sometimes surgeons when they have to have the specific, operations. Whoever is important to making sure that we treat the person as a whole and know that their whole well-being is taken care of, they need to be involved in their care, of course, with the help of the victim. Those are my selected references. I thank you all so much for your participation and your attention during this very important conversation. And I pray that you are equipped to be able to at least start the process in making sure that we can safely intervene and enter and isolate these victims. All right. Thank you so much for your time.